Hi, this is Stacy Merrell, and this PowerPoint presentation is an assignment for Nursing 493, Community Health Nursing 2 at Aspen University. The PowerPoint and my community health project is on improving access to healthy foods in Southeast Indianapolis. First, a little bit about me. I've been a nurse for 25 years this year, and I have equal experience both in acute inpatient settings and then also in community settings, which includes community health clinics and care management programs. Currently, I am employed by an insurer, and I collaborate closely with the teams there who are responsible for population health. Each week, as we would go through the different modules for Community Health Nursing 2, we looked at a different aspect that we needed to focus on for our project, including determining the topic, identifying the target audience, planning and developing our project, and then the actual implementation and an evaluation of if that project was successful or not. I began with the determination of the topic. I had used data that I had gathered from my Nursing 492 community assessment, including the windshield assessment, and had analyzed that data at the end of that class. And so when I started thinking about what topic I wanted to choose for this project, it took very little research to understand that I wanted to focus on nutrition and healthy foods promotion in an attempt to decrease the obesity rate in Indianapolis. And that went right along with the health needs that I felt like could be addressed in this project. Once I understood what I wanted my topic to be, I quickly realized that my target audience was too broad and that I was going to need to narrow the scope of that target audience. And so I made the decision to focus on a subset of the city of Indianapolis and instead concentrate on residents in the Southeast Indianapolis community, which is comprised of 4 neighborhoods. Fletcher Place, Fountain Square, Garfield Park, and Beech Grove. And it felt like they would best benefit from this topic for a couple of reasons. The first one is because those 4 neighborhoods lost 2 grocery stores within the past 12 months because of a large Indianapolis grocery store chain that had gone out of business, and those stores had not been replaced. And also because having worked in that area before, I knew that these people tend to stay within their own neighborhoods, and so the loss of a grocery store would make them rely on convenience stores that were in their neighborhood, which do not offer the same healthy choice of foods. Also, whenever I was considering this target audience, I recognized that I was going to need to understand the makeup of these residents so that I could effectively tune my project towards their learning style. Different topics or different factors that I took into consideration included age, gender, ethnicity, education level, and then I also looked at what their level of community engagement was to think about what might positively motivate them to be involved or to be receptive to this topic, and what their general health level was, specifically the obesity rate. In planning the project, I knew that I wanted to be able to bring healthy alternatives to a grocery store, since that had been taken away from these residents. And so I collaborated closely with my chosen community health partner, which was Southeast Community Center. And we talked about different options that might be out there, and I started researching those. And that helped me come up with realistic expectations for what could reasonably be completed within the time frame of this course. And then as I started thinking about, narrowed my topic down to a couple of different ideas, I became involved with an additional partner that would be helpful in bringing this healthy food alternative to these residents. And that was a representative from a hospital system that was based in Indianapolis, but affects the state of Indiana, Indiana University Health. And the program that they had come up with was basically a mobile farmers market that's called Garden on the Go. And so I talked to them and try to get a better understanding of the services that they provide already in other neighborhoods, and realized that I thought it would be a positive way to bring non-traditional options for healthy food choices for these residents. I was also able to talk to them and figure out what types of teaching materials had worked well for them, and what materials had not been as effective, which allowed me to use that information whenever I started considering my own materials that I would have for my presentation. The actual implementation of this project for me was presenting this idea to a neighborhood leadership meeting. And this was a group of leaders in the Fletcher Place neighborhood who meets on a quarterly basis. They meet at the Southeast Community Center. There was already a meeting that was scheduled for mid-March, and so they graciously allowed me to take the first 10 to 15 minutes to talk to them about this. And so I created an agenda for the meeting and also asked the representative from Indiana University Health Garden on the Go program if they would be available for any questions that those neighborhood leaders might have for them. I presented as my community education project the proposal that this neighborhood take advantage of this Garden on the Go program for its residents. The program will bring produce to a location at the same time every week, and residents can come, they can pay there, they can, touch the produce. They might have exposure to healthy produce that they've been unfamiliar with in the past, and the people who unload the produce are also knowledgeable about what the produce can be used for, the nutritional value, and might positively influence to make produce choices that they wouldn't have thought of. And even if they didn't want to try something new, it gave them healthy food options that were right there in their neighborhood that they could go and use rather than utilizing a convenience store. The feedback that I got from the neighborhood leaders was very positive, and they are very interested in pursuing this option, and we're in process of setting up delivery dates that will fit into the Garden on the Go program's schedule. I'm excited about this because I'm also a resident of this community, and I live in the Fletcher Place neighborhood. And this is something that I can continue collaborating with the Southeast Community Center to ensure future success, and can make sure that we can spread the word and make residents aware that this program will be available. And so, although the final portion of it will not be completed during this time frame, I believe that it will be a future success.